Okay, let's get it going. All right, good afternoon, everybody, or depending on where you are, good morning. My name is David Bergman. I'm a strategic advisor with SlicedHealth. Certainly appreciate everybody making some time for us today. Going to introduce Mike McKenzie and Suzette Ron, who will be our presenters today. Just a couple of quick house cleaning items. We really intend on this being a 45-minute presentation. You should have access to a chat, and we will entertain questions at the end of the presentation. We hope to have some time to address those. If we don't have enough time at the end of the event, we will certainly do some follow-up with you directly in regards to your questions as well. The goal today is we're going to discuss how to uncover and recover missing revenue. So we certainly appreciate everybody attending today, and I'm going to go ahead and let our speakers, as you can see here, take over and start having a conversation about their thoughts on how we uncover and recover lost revenue. Suzette, I'm going to start it off with you. I mean, we have some goals here, obviously, and how it's going to go about. But I wanted to go ahead and start you off with a question, and then let you and Mike go ahead and have some conversations about what we're seeing there.
Okay, fantastic. First, I'd just like to introduce myself. My name is Suzette Ron. I am in Texas, born and raised Texas girl. I have been working in RCM for roughly 27 years now. I actually started my career as a staff accountant and was then quickly introduced to the world of healthcare. I became sucked into it, as lots of people do. I've worked in various aspects of the revenue cycle, primarily with billing, AR follow-up, collections, payer relations, underpayments, contract management, and any other, aspects that deal with those payers. So I am excited to be able to talk with everyone here today and present some information that Mike and I have to share. And Mike, I'm going to punt it over to you for an intro.
Hey, good morning, everyone. Thank you, Suzette. Mike McKenzie. I'm a healthcare technologist. I've been in the space for almost 30 years now. A little bit on my background. I started out in the pharmacy, worked as a pharmacy tech in nuclear hospital and retail pharmacies. Took a penchant for technology, and really from there it took off into the pharmacy informatics space. That led me to the full electronic health record in an organization. Around 2009, I partnered up with two individuals I'd worked with at McKesson. We architected and built one of the first cloud-based electronic health record systems. And ultimately, we sold and implemented that into over 150 hospitals throughout the United States. We ended up selling that company to Athena Health. I've served as a hospital CIO for a long-term acute care facility. In addition to that, I've worked in the health and longevity space as a CIO as well. And I've also helped found the SlicedHealth company that we're going to be speaking about today as well. Suzette, do you want to get started with the question, and then we can field any conversations that follow from there?
Absolutely. So really, the first question is, what is the difference between being reactive and being proactive? So, being reactive it's about missing those opportunities that we have to discover and uncover revenue, because really the ultimate goal is to collect more money faster. So, I want to talk a little bit about some of those missed opportunities, and really let's talk about how it pertains to missed opportunities within revenue cycle. So reactivity in revenue cycle is often shown in claim denials, billing errors, or any compliance issues, which slow down your cash flow. The other issue that it could reflect is actually a decrease in patient satisfaction. And we all know how important it is to make sure that we keep the patients happy. The cost of reactivity in healthcare, it stresses your RCM team. It undermines your financial and operational performance. And it really is just a drain on the system altogether. So, Mike, did you want to talk a little bit about proactivity?
Yeah, well, actually, I'd like to dive a little bit into some of the operational issues. Obviously, you've got a wealth of experience in this area. Reactivity, it's really a cost on the organization. And I was hoping you could share a little bit operationally where you see some problems crop up with organizations.
Absolutely. So billing and coding accuracy, that's probably your first one. Increased
Mhm.
coding errors, missed documentation reviews, upcoding, unbundling, things like that. Medical necessity denials. Yeah, those are some things that we see when being reactive to a situation. Claims that might be submitted without verifying the clinical necessity. We have timely filing issues. Those are some of those areas where we're being reactive, again, resulting in that lost revenue. Um, so, I think it's important that we focus, and it's easy to sit in a webinar, and I think we've all sat in webinars and we've gone, okay, that sounds great. How do I implement it? And I always use the old adage, it's one bite at a time. That's how you eat an elephant, one bite at a time. It's those small areas of opportunity that you can take within your organization to determine how you can turn that reactive approach into being proactive. I know we've all talked a little bit about the root cause of denials. How can we identify the root cause and then what do we do about it? Because let's face it, identifying it is one thing. Actually implementing a process change to correct it is something entirely different.
Yeah, you spoke about the timely filing. And, from your experience, where are you seeing a lot of those issues crop up, particularly, through the process parts of the organization, not necessarily the technology parts of the organization?
Yeah, there's a few different areas, and interestingly enough, where we oftentimes will see it is at the time of registration. So if you don't have a very robust registration department with real-time eligibility checks, you often will either, and I've seen this happen, I've seen registration clerks that will register from history, meaning the patient might have been seen 5 years ago and they had a certain plan 5 years ago, so we're just going to have, we're going to add that plan again for today's service. So that's one area that I see it in. That's a missed area of opportunity because if it takes you a few days to get that bill out the door, you now have a denial from the insurance company saying that that patient's policy had termed. Now we're being reactive. We're going to the patient saying, hey, we've got the wrong insurance information. And, really, the patient's probably not likely to pick up the phone when you're calling to get that insurance information to be accurate. So then we need to employ other real-time eligibility solutions so that we can identify who the correct payer is and bill the claim accurately. Another area of opportunity, I think, and an area that gets missed is just charge capture. We need to
Mhm.
make sure that we have a very robust method of identifying what procedures have been performed and what charges we actually posted with those procedures. One of the problems that we see with timely filing is when that reconciliation is performed, unfortunately, the claim often is past the filing deadline. So those are a couple of areas right off the bat that I think that we could kind of nibble at and focus on to be able to help improve those processes. Because I can guarantee you, any business office director, any chief financial officer sitting out there, the one denial that drives them absolutely crazy is a timely filing denial because that is 100% preventable.
No, absolutely. Obviously, credentialing is an issue that creeps in as well, particularly with physicians, getting them onboarded into an organization, just general
Mhm.
provider enrollment. Maybe you could share a little bit, from your experience with what you've seen issue-wise with getting that set up for, say, a new physician that's coming into an organization.
Yeah, absolutely. And it's a matter of being able to house all of the contract information that you have and matching that with the providers, ensuring that they're credentialed with the hospital, with each payer, so that there are not any gaps in the process. There are actually certain system applications that are out there that are fairly cost affordable for hospitals to be able to employ, to be able to kind of manage that aspect. I actually was fortunate enough to view a demo not too long ago of one of those system applications that helps you to just manage that credentialing process. I know that it's a monstrous feat and it's incredibly cumbersome. And unfortunately, the denial reasons don't always show a credentialing error. And so you don't really know how large that problem is until you really dig in and get into the finite details. And what I mean by that is we may see a denial reason for no authorization. When you start to dig into no authorization, it's not that the service had to be authorized, it was that the provider was not credentialed. Why
Mhm.
that was a reason that was attached to those denials, I have no idea. Again, it's some of the games I think that the payers like to play with us. But it's harder to be able to identify those. So again, you're being reactive to a denial reason when you could be proactive in ensuring that your credentialing is set up appropriately and that all of your providers have all of the necessary documentation in order to be able to bill those claims effectively.
Well, aside from the IRS, I think the second most scary thing for an organization to hear is RAC audit. And maybe you could talk a little bit around some of the audit preparedness that organizations can take to get ready in case that does occur.
Right, absolutely. And again, I think it's it's a matter of a staffing issue in a lot of organizations to be able to prepare for something like that. But that is the reactive side of things. So I think in preparing for a RAC audit, having all of your proactive strategies in order will make a RAC audit as simple as a cost report. It's being able to have all of those details, everything lined up, so that we're not looking at claims that were billed with a higher level of care than was actually offered. We're making sure
Sure.
that we did not send claims to Medicare that for services that were not actually rendered. Hard to believe, but that actually does happen. So it's employing those front end processes again to ensure that on the back end, when you're going through a RAC audit, those processes have really kind of taken care of those difficulties and those issues for you.
Oh, well said. I think one other thought that comes to mind as I'm listening to you speak about this is prior authorization. Specifically, you mentioned medical necessity, but prior authorization, obviously, when and how you capture it, what tools that you utilize. Would you be able to speak a little bit about the benefits of having that? And then I, certainly can follow up with conversation about getting that implemented into an organization from a technical standpoint.
Hmm. Absolutely. So, with the prior authorization, I think, most hospitals have done a really good job and are very aware of what procedures require a prior authorization and for which payers. But there's always those new ones that crop up. You may have never required a prior authorization for a chest x-ray before from Blue Cross Blue Shield, but hey, all of a sudden that might be a requirement one day. So I think the importance in having a robust prior authorization application is something that can house all of those rules that each of the
Hmm.
payers employ. And the rules they're cumbersome and it's almost impossible to try to keep up with. And that's where I think we can talk a little bit about, the AI driven tools that are out there that help to identify what new payer policies are out there. And we're going to talk a little bit more later on about some of those payer policies, because I think that's where the payers get you quite often. You can have a contract in place that tells you how a claim should be paid. You could have a process in place for performing prior authorizations. But if we haven't looked at what the current payer policies are as it pertains to contract reimbursement or prior authorizations, then that's where those payers are going to kind of ding you. That's where AI
Yeah.
can come in.
Yeah.
So I
No,
know
well,
you can talk a little bit about that technology.
no, absolutely. Well, obviously with prior authorization, the question is it going to be an external partner that you bring in, or does your current electronic medical record system offer that? And then, of
Mhm.
course, what are the integration or capabilities of it? Because you touched on registration. Obviously, registration, they're going to be dependent on doing the prior auth as they're scheduling a patient, perhaps if you have surgeries that you perform or any type of outpatient procedures that you may do in your facility. And of course, making sure that that prior authorization occurs to limit any kind of denials that you may get as a result of not having done it. And then of course the question begs, well, how do they charge for it? How do these vendors charge for it if they're external versus internal? Which gets into a software selection process that we'll talk a little bit more further on in the cast here. But I
Mhm.
think one overarching theme here, as it pertains to the technology is, the adoption of it. And a lot of these technologies that get put into organizations, they're often underutilized. And, some of the reasons that that happens is it's a lack of clear alignment, business goals, lack of poor data quality. And I'd like to touch for a second, in lieu of these conversations where we've already had, about the data. And data, it's really the new oil, if you will.
Mhm.
You have to think of it as a strategic asset, and it's going to be what flows through the veins of technology that your organization sets up. That data, that oil, it has to run run through seamlessly and align with your business objectives that the leaders, particularly on this call, have laid out for their organization. And, to implement that, it can be rather daunting. So, obviously, when you do a data focused project, you collect this data that's raining out from these various systems. You want to try and take a comprehensive approach, but sometimes that's not possible. Ideally, you want to just start with something that's simple and actionable. And, starting with, as an example, improving your organization's data assets. The benefits of having things in a structured file format. It's going to make it easier for you to share it. It's going to make it easier for you guys to be able to collaborate both internally and also externally. If you bring in a partner that's going to be helping you perhaps compile the cost report, or is going to be working with you on denials, they need to be able to easily get access to this data. And the good news is at least from my experience as a CIO in the hospital space, many organizations use vendors like Microsoft. And with that subscription that Microsoft provides comes tools like SharePoint. Not the easiest tool to use, but it can certainly be effective to help you organize contracts and, as an example, business documents, payer contracts that your organization
Mhm.
has. Um, and then I think one other area too from this data that you can pull from it is developing just a simple set of KPIs that really can help inform and direct your team to make you a data-driven organization. Some of the obvious things, of course, are days in AR. Maybe look at claim denial rates, or what are the clean claim rates, if I can say it properly. But and then, of course, what is your cost to collect? And I think on the data topic, one final point that I'll make, particularly around most of the organizations that would be hospital organizations that would be thinking about data and data strategies, would be their charge master and the charge master cleanup. When you look at a charge master, as complex and as challenging as that system can be, if you're looking at it, for instance, medications that are on there can often be misrepresented. You can
Mhm.
wind up with outdated and incorrect information, which it's systemic through an organization. So your charge master, obviously, with the transparency rules, mandates that you put that out onto the web. Getting that cleaned up and keeping it cleaned up is paramount to being able to provide that accurate data to the spirit of the law about putting your charge master and your charges that charge, for example, aspirins and Tylenols and
Mhm.
so forth through your organization. And really, one of the simple ways that you can acquire that data is through your wholesaler. You can sit down, chat with your pharmacy buyer. You can ask them, hey, I'd like to get a 90-day purchase report from McKesson. That's who we do our does our wholesaling.
Mm-hmm.
Provide us with that information. But yeah, that's data. I wanted to certainly focus on that because that is ultimately the underpinning of what informs that AI and that AI strategy that a lot of organizations aspire to use.
Yeah, I agree, and that's 1,000% right. You can't, we can't talk enough about the importance of data and what we can learn from data. But the data is also only as important as how it's generated. And I think we all can agree that you could probably take any number of data points and tell whatever story you want to tell. We could take the same data set and tell two completely different stories that could be backed up by that data. So I think it's imperative to really have a good, solid understanding of what you're seeing, what you're viewing, and what that data is telling you. But not only what it's telling you, but then what you can do with it and how you can be proactive in making those changes with that data. So
Oh, absolutely.
several years ago, I was working with a hospital system and consulting on some of the denials that we had seen. And I did a case study for them. So in year one, I think they had referred about 8,000 denials to be reviewed and worked. And after the first year, the CFO and the chief RCM officer came to visit, and they wanted to hear about the findings of this report and what we had identified with these denials. And we were able to take pretty much every single denial and point to the root cause, and not only point to the root cause, but also point to the area or the department of responsibility, what area caused that denial.
Mm-hmm.
Those individuals took that data back and they met with every single one of the department heads that were responsible for those various denials. And in year two, the denials decreased to probably, I think they decreased by 70% just by employing those front end process improvements. So I can't stress enough how important it is to not only take the data, ingest the data, and learn from the data, but then to employ a process improvement based on what you're seeing.
Well, and information in the absence of action is noise. And what you
Right.
implemented there was the action. And that's the core piece that a lot of organizations miss out on. It's great, I'm getting these KPIs, I'm getting this data, but what do I do with it?
Right.
And then, obviously those are strategies that an organization can implement to be able to deal with that. Just in the interest of time, perhaps we could move back into the, I guess, set of questions here. Obviously, I think we've got showing on the screen what is the difference between being reactive and proactive. And, perhaps we could take a moment and just, pardon me, chat for a second about, that in the context of contracts and payment life cycle. The risk is, if you will, of being reactive. And maybe, Suzette, you could share a little bit about what some of those risks are, and then we could follow up with some of the benefits of being proactive in that area.
Yeah, absolutely. And one of the areas that I really wanted to touch on with the time that we have is contracting. I don't know that we give enough credence to the contracts that we have with payers. I know that there are many organizations out there that have contracts that date back to probably the early 2000s. I don't know how often those contracts are reviewed and how often those contracts are renegotiated. So I think the first point to make is, when we're talking about how to become more proactive in your RCM approach, let's talk a little bit about contract management. One of the first things to do is let's gather all of those contracts together and see what you actually have. I would imagine that there are a large number of hospitals that can only suppose or can only guess what they're supposed to be reimbursed for certain services, but they don't know for a fact. So gathering those contracts together is the first step. And believe me, I've seen contracts in the bottom drawer of a filing cabinet down in a basement that nobody has visited for quite some time. So I know how difficult it is just gathering the contracts, number one. But believe me, the payers have those contracts because that's how they're paying your claims. The second thing is just being able to analyze those contracts. A robust contract management tool will uncover all kinds of things that you may not have been aware of. So let's marry what we were talking about with the charge master to our
Sure.
contracts. So oftentimes, and I've found this probably more often than not, there are certain procedures that hospitals perform on a regular basis where their charge master is less than what their allowed amount is from the payer. So, for example, an MRI, your charge master might be $650. Blue Cross Blue Shield may allow $1,200. You may be missing out on that delta because those payers have a lesser than clause within their contracts. And what that means is the payer will only pay up to total charges or the allowed amount, whichever is lesser. So one of the areas where we've been able to uncover quite a bit of money is just by taking a look at the charge master and comparing it to some of those allowable amounts. We call that underbilling, and it's a chronic issue, and it's probably happening at more facilities than we know of. So that's one area where you can take a bite of that apple and really start to identify where you can improve in those areas. Just a word of caution, oftentimes your contracts will have language written in them that says you can only increase your charge master by X% every year. So I would encourage you to take a look real quick and see if any of your contracts have that language. And if you have not had a charge master increase in the last several years, you may want to start taking a look at that to see what you can do, because it could take years for you to achieve and realize those dollars that you actually should be collecting.
Oh, absolutely. Well, it seems like these or particularly these payers, their sole purpose in life is to figure out how they can deny and delay,
Mm-hmm.
through denials and underpayments and tricky contract language. Moving through here, maybe we could talk a little bit on the proactivity side. As an example, I think I mentioned earlier on about clean claims and, some of the strategies that you've put into place with
Mm-hmm.
organizations that you've worked with on that topic.
Absolutely. One of the biggest areas of improvement that any organization could make would be to have a real-time eligibility solution.
Mhm.
Now, I know that real-time eligibility solutions aren't necessarily foolproof. I've actually seen some, well, I'll just call it by name. Sometimes the Epic real-time eligibility solution will bring back traditional Medicare and the Medicare HMO product. And so then it's up to your staff member to choose which one they think that the claim should be billed to. Again, these are
Mhm.
little things that delay payment. So the whole goal is to collect that money faster. So a real-time eligibility solution can help with that. If there's anybody listening in on the call that is from a Texas hospital, we have, I think, 26 Texas Medicaid managed care organizations, which is just insane. It's outrageous. But that means that in some cases, your patients can hop from plan to plan, and you may not know it. You may not know if they're on Molina today and they're on AmeriGroup tomorrow and, Superior the next day. I'm joking a little bit because it's a monthly change, but it is important to note that those things happen quite often. A real-time eligibility product would be able to help you identify immediately what payer that patient is eligible with on the date of service. That's one of the best ways that you can ensure those clean claims. Take a look at your
Okay.
coding team. Take a look at some of those coding errors that you may have had in the past, and see what you can do to make those corrections. On the front end. Let's ensure that we have that claim clean and appropriate at the time of billing. Another issue that we've encountered is with NPIs.
Mhm.
If you have a number of different NPIs within your organization, make sure that your registration team knows exactly how to register those patients so that's billed under the correct NPI. An incorrect NPI comes across as another weird denial reason. It could come across as out of network. It could come across as no authorization. There's any number of things. It could come across as non-covered charges if you have an incorrect NPI on your claim. So those are some of the things that you can correct on the front end. And, it really doesn't cost you any money to employ some of those processes. In fact, if you employ a very robust insurance discovery or real-time insurance eligibility program, you would probably pay for it on the back end by not having those denials that you're having to chase after, by having those resources at your hospital that are chasing after those denials.
Well, fantastic advice on that. So I appreciate you opening it up a little bit more on the clean claims. Thorough as always. Let me switch gears real quick. We one of the questions we had was, why are hospitals stuck in reality loops and or reactivity loops rather,
Mhm.
and the impact of reactivity loops, particularly on financial, the administrative part of the organization, and even technology. Maybe you could take the first two, and I'll follow up with the technology piece of it.
Yeah, I think one of the big things, and again, this is one of the things we're talking about right now. It's capital restraints.
Hmm.
Unfortunately, to employ a major change, it costs money. And if you don't have a solid view on what your ROI would be before employing that kind of change, it could be very, very difficult to try to do that. I know that there are systemic challenges, which I know you can talk about, operational issues. It is difficult to find good people to work your claims. It's difficult to keep those staff. And especially if you're in a market where you have, maybe 30 minutes to an hour away, you've got a behemoth hospital that's paying, 5, 10, $15 more an hour for those employees. It's going to be really difficult for you to keep those folks. So finding those skilled staff members to be able to help you overcome some of these challenges could be very difficult. And that's when, you can talk a little bit about employing a strategic partner. But first, let's talk some, Mike, about, in addition to those capital restraints, those systemic challenges that we know that hospitals are faced with today.
Yeah, particularly around technology, and it's really is what you're implementing technology wise a department project, an organizational project, or is it just oh, that's the IT department's project? And really, what
Yeah.
the underpinning of that is there staff buy-in? That's going to be critical to any type project that you're implementing in your organization, particularly with technology. And when your team they are on board and they're engaged, it just makes the implementation of any new technologies, particularly strategies or business partnerships, as you mentioned, a lot more efficient and effective.
Hmm.
I know with particularly IT implementations, one of the key strategies for managing that is implementing project management, and that's comes from both an internal perspective and an external perspective. On the internal perspective, it's do you have an internal champion, somebody that can manage the time, resources, and materials and the costs of installing this. But converse to that is the partner that you're bringing to the table implementing a project methodology with a knowledgeable resource that's going to help keep you aligned with those time, resources, and materials. And that's really where the selection process comes into play, and finding that right technology partner that's going to bring in, an innovative solution, but also offer a fresh perspective with deep experience. In today's world, really any partners who prioritize data decision making, um, they have, and are strong communicators and obviously are transparent. That those are ideal partners that you want to bring in when you're installing technology, particularly in the revenue cycle space, as important as it is
Hmm.
to an organization. And then, obviously the strategic business partnerships, you brought that up. Maybe you could just talk a little bit about some of the value from the operational side that has for the organization, and some of the considerations.
Yeah, absolutely. So, to me, being a strategic business partner, it's finding an expert that aligns itself with your goals and your processes within your organization. You don't want it to just be another vendor that you're using. You want that
Hmm.
partner to actually work collaboratively with you. You want them to work with your team. You want them, if we're talking about employing new software, you need that partner to be able to work with you on that software. I think probably everyone on the call can raise their hand and say, yep, I've employed software that never got used because we didn't put the time and effort into it. You need a partner that is willing to put that time and effort into it to show you the value of what you're employing. And I know, the other thing that we hear oftentimes is, okay, I just don't have time for that. But really, what we don't have time for are missed revenue opportunities. So
Absolutely.
it's finding that balance, between the business partner again that would align itself with what your strategy, your goals are, and the ability to work collaboratively with you on those. And sometimes, I like to say that, I go down some rabbit holes with, some of our customers and some of our partners, and we'll dig into just the most mundane issue that we can find to help solve that problem. But again, it's being collaborative with them, and I think that's the most important thing. I think you want a strategic partner that goes beyond being a taskmaster. We can employ any number. There's literally hundreds of RCM partners out there. You can employ
Hmm.
any number of those who just do the task. But really, what we want are partners that are actively participating with you in revenue growth. I think that's the
Yeah.
ultimate goal.
Yeah, and being able to have those partners, help along, say a implementation process. I know one hospital had a conversation with recently said, "Hey, we're, switching electronic medical records, which means we're switching, accounting systems." And, I've been down that path over 150 times, having developed and installed other vendors' electronic medical record systems. Without fail, every single switch always causes a dip in AR. And one of the common refrains you get, say, if you've got a tertiary solution that's kind of monitoring those claims and how effective collections are, is, well, we just don't have the time or the interest. But that's one of those things you really need to try and find the time and find the
Mhm.
capability to implement, because you don't want to go unmonitored in that area, because in the fog of war doing an implementation, you're really focused on getting that solution stood up, getting the organization to buy into it. But ultimately, you also need to keep in mind, are you generating adequate AR? And a lot of times when you do those kind of switches, you'll see a significant drop. So you want those tools in place. And that's where having these, strategic business partnerships is critical to an organization.
Yeah,
Um,
absolutely.
I believe we've come up on the hour here. David, maybe we could open the floor up for any questions or um, comments that team on the call has.
Yeah, I think that why don't we just roll in and address this quickly, and then we'll get into the Q&A about our partnership. Just give you like a minute each, and then we can get into some questions.
Yeah, absolutely. I'll chat just real quick about Sliced Health. I am one of the founders of it. We do help hospitals recover, uncover, and discover revenue opportunities with our software solution. We're able to model out payer contracts. We can track expected versus actual payments, and we can also help with the recoupment of any underpayments before they really start to snowball on you. And Suzette, would you like to chat briefly on Simple Health?
Absolutely. So, Simple Health is working as a partner to the Sliced Health team. We are the RCM vendor for Sliced Health. Some of the areas where Simple Health can help out is with prior authorizations, insurance verification and discovery, We have an RCM staffing model that can assist you with your AR claims follow-up, denial management. We have a patient engagement tool that could assist in really engaging your patients both on the front end pre-service and on the back end post-service, doing not only just patient collections, but we can also engage in patient surveys if that's something that a hospital is looking to incorporate.
Great, thank you, Suzette. We have a couple questions. Let's go try to tackle these here in the next couple minutes. One question is: we are a rural hospital. What are time commitments and costs involved?
So, as a rural hospital, really what you want to focus on is an area of high impact. We talked a little bit about the eligibility verifications and denials. There are some free payer tools out there that can help with some of that. Building your staff to have cross-training functionality. One of the things that I always like to do is have my back-end denial folks actually work the registration desk so that they can see how difficult that is, and have your registration folks work some of those back-end denials that were caused by registration. It really gives them an opportunity to really understand what both parties. I think, again, I can't stress enough that it doesn't have to be an expensive process to undergo if you just take that one small step, that one small bite of the apple and, work through kind of your biggest pain points and your biggest problem areas.
Yeah, and the data side of that too. Some strategies I mentioned earlier, just opportunities as an example to create a folder structure, collect those contracts, put them into a place that are easily accessible by your team. I mean, something as simple as building out an Excel document. Who are your payers? What are their contacts? Being able to easily access that information, it removes a lot of the frustration that your organization would encounter.
Yeah.
And it's frankly just time and material that's very, very little cost, if any.
That's a great idea, Mike, and you're absolutely right. I think employing something as simple as just a matrix with all of your payer, contract information would be incredibly helpful, and at least it's a jumping off point.
Great. I know we're running out of time. I'm going to try to give you one more question, see if you guys can do a 30-second answer on this. But can you give an example of a hospital that made the shift from going from reactive to proactive?
Absolutely. And I think, and the question may have come in prior to me having the conversation, but there was the hospital where, their proactive shift was in ingesting the root cause analysis that we had provided to them. And through that root cause analysis, they were able to identify the areas of opportunity with each of their department heads where they could improve those processes. In turn, they saw their denials decrease significantly. So I think employing not only a root cause analysis, but then actually implementing a front end process improvement using that information, it really can get you far.
Yeah, and I think I'll just add on to that too. I had one organization that was switching electronic medical record systems, and they too brought up the question of, how do we allocate time to standing your solution up and keeping it maintained? And my answer to them was, well, really, don't you want to be able to see the before and after effects and
Right.
be able to pinpoint any issues that come up as a result of you moving to this new technology? They fortunately made the decision to keep it in place, and they were able to, quickly firefight issues with collections as they came up.
And
Great. Well,
and you know,
oh,
to
go ahead,
that, just
Suzette.
one more comment to that point. I think employing a business intelligence technology, again, doesn't have to be very expensive, but it is something that would absolutely highlight any of those errors that we have talked about and identified. And it's a quick area of opportunity for you to be able to really see the data and see what's going on, not only within your claims, but how your payers are behaving. So that's another step, again, fairly cost effective, but could have, real benefits in your ROI.
Well, good. Well, we committed to making a hard stop 11:45. I know there's a couple other questions that are here. We're going to make a copy of those and we will respond back accordingly. on that. I certainly appreciate everybody taking their time. Special thank you to Mike and Suzette for your time as well. We will be posting a copy of this recording on our website. So if you'd like to go in and visit the Sliced Health website, you can get access if you want to share with your team as well. And we are working on doing these on a monthly basis. So if you're curious about other topics, please pay attention to what we are posting on our website for future webinars. And thank you everybody once again for your time. Have a great day.
Well, thank you, David. Thank you, Suzette.
Thanks, Mike. Thanks,
Good
Dave.
day.
Bye.
Bye-bye.